Welcome to Innovation Obsessed, where we explore strategies and technologies shaping modern security. Today, we are talking about healthcare security, one of the most complex environments to protect. Joining us are Lou Martin and Bill Gable from NextGen, bringing their on-the-ground operational experience, and Nathan Snyder from Oosto, offering a technology-driven perspective. Before we dive in, do you guys want to tell a little bit about yourselves and your background?
Sure, I'll kick us off. So I've been in the security industry for about 10 years. I started as a technician in the field, worked up through service, became a project manager, and now I'm the director of operations for the East Mid-Atlantic Division.
Yeah, so Lou Martin, I'm the vice president of the Northeast and Mid-Atlantic. Started in sales as an account manager, grew to the sales manager last couple of years, and then this past year moved into a vice president role here at NextGen.
And I'm Nate Snyder, the director of inside sales for the Americas for Oosto. For the last decade, I've been focused on helping customers use technology to get more out of their operations, really improve, their visibility into, not just protecting their profit margins, but really maximizing all of their resources. So lately, I've brought that to Oosto and been looking for ways to help our customers really focus on protecting their people and assets. So excited for the conversation about healthcare.
Nice. No, okay, that is great. Thank you all for the introductions. I'm excited to get started. Bill and Lou, I'd like to start with your thoughts. As an integrator, you work with a lot of healthcare clients. What security issues do you see them struggling with the most?
So one of the biggest things that some of these healthcare systems that we deal with struggle with are staffing when they're growing at a high rate, right? So healthcare facilities and throughout this whole area are growing, exponentially and continuously. So staffing is one thing, and then their operational flow on how patients come into the buildings and how they, maneuver out throughout the hospital and healthcare facilities is one of the biggest things I would say.
Yeah, and there's a big shift in the healthcare industry as there's a lot of consolidation going on with hospitals acquiring other smaller hospitals. So standardization is a big thing for us, is making sure that they have a single access control, a single video surveillance system that is easy to manage, that helps budget, for, future projects. But again, a lot of these hospitals have different systems. So it's our job to kind of do an audit of what they have and then, put a standard in place for them.
So Nathan, considering the many moving parts to securing healthcare facilities, from a technology perspective, how can AI and analytics help healthcare facilities stay ahead of all of these security risks?
Yeah, that's an important question. And from what was just mentioned, I mean, the theme there is that change is constant in these settings from a business standpoint, facilities, the ways that you need to provide care for patients. So for folks who work in this industry, you're really looking at where can I deploy resources to help keep the best, quality of care for our patients? How do we retain talent in such a competitive market? And the way that we view technology in these settings is that it makes people's lives easier. It protects people. It makes sure that you don't have disruptions to care so that the patient and, worker experience is better. And the people is really what this industry is about. So when you deploy AI that can do the jobs of multiple people, the folks who are working in that setting or the folks that are getting care in that setting now don't have the disruptions. They don't have, to look over their shoulder and worry about things because the AI is doing a lot of that work in the background. So excited to share more of, the ways AI is kind of reshaping some of these strategies and helping this, setting be really a place where people can focus on getting their, health taken care of and getting the care they need.
Those are really great points. I'd like to learn more about how these solutions are implemented. From your perspective, what is the biggest challenges in making security a seamless part of hospital operations?
So one of the big things is trying to find out where the areas in these facilities need to be secured the most, or what is hurting the most in these facilities for the need of, the access control, your cameras, et cetera, when it comes to that. And some of the things that we run into is in the EDs or in the ORs where there needs to be a bunch of cameras, but there's also a privacy factor of patients. So placement of all these devices is very important. And then as well as with the access control piece, when you're putting in card access, when you're doing all these, secured doors or different events that lock doors down in certain scenarios, they need to be in a particular way, and they have to abide by a certain code and standard, which is, it can change per AHJ, and no matter, in whatever area you are at, in this area.
Mm-hmm.
Yeah, and that's what makes us successful, right? Is, knowing, where the standards are in each of these areas, and making sure that, we're not, you know, any of the rules are not broken in terms of installation. And that's why, Bill's operational team and our service team, they really need to know the insides and outs of the hospitals, because they are different depending where they are, what areas the actual hospitals are. So, Bill and his team do a great job of making sure that whoever we're sending are fully trained, and they know exactly where they need to be and who they need to talk to before installing anything in these areas.
No, that's a great segue. How have you seen your customer security teams efficiently and successfully manage risks, especially pertaining to visitor management and access control?
So one of the things that we do is we work closely with the security. Typically in the healthcare world, you're working with a director of public safety, or sometimes the CEO, or whoever the case may be at that point of contact, and you're working very closely to strategize on the areas of need for all these different things that we have to implement. So visitor management obviously is one. Where the welcoming desk is, where they're going to be pulling people in, how much security do we need, how many cameras do we need a facial rec there, do we need whatever we need there, So
Yeah, I think it goes back to the standard, and making sure that we have a standard for the pharmacy, we have it for the ORs, the EDs, and, we have a plan put in place, and it's not, we're not just shooting from the hip. I think, if we can talk to their, executive leadership team and say, hey, this is what we want to have the standard at your pharmacy, and working, with the head of pharmacist, the security team, facilities, making sure everyone is cohesive and, know exactly what the plan is, and we know what we're planning and implementing.
Yeah.
Absolutely. So you brought up a great point about team cohesion. Nathan, with the challenges of securing hospital emergency rooms to restricted areas, how do you help healthcare facilities ensure security measures are in place without adding friction for staff or patients?
Yeah. Great question. And I'll go back to what they just kind of outlined. Lou's just making the point. You have a pharmacy and you have an OR. You have different areas for different purposes within these settings. You have, live-in care facilities versus, different units for different purposes. And they each come with pretty unique challenges. And, the kind of two buckets of, threats, or the two lenses to look at them through is, you had your outsiders who are coming in and could pose a threat to these physical spaces and the operations of it. But then you have your insiders who you need to help keep those measures strong, right? So, what I think of is, I have two beautiful daughters, and, the two times I was staying with them in the hospital, it was, very apparent when we came in that, hey, this is a secure area. We had to be, checked in at the front. Mm-hmm. They knew we were coming. We knew where we'd be going and who we'd be interacting with. And it was very obvious, like, that was a secure facility. And we're thankful that there's folks like NextGen to help make that possible. But you look at things that technologies that can be brought in to make that even stronger. So with the access control, can you verify, it's not just a badge, but it's a face being paired with the badge that matches that it's that individual. Because you have to worry about former disgruntled employees. You have to worry about, sometimes there's temps who, I'm sure they were screened, but they could be given access to things that maybe they shouldn't. So the way that we look at it is if we can pair technology with some of these measures to make sure there's another layer to prevent incidents. That's what we're really passionate about, is helping teams do more with less by verifying that it's just the people who should be in the pharmacy, just the parents of the newborns in that section of the hospital, to make sure things go the way they're supposed to go.
Absolutely. So you mentioned doing more with less, and I'd like to hear from all of you. How do you see this working out with technology being as effective as it can be, but keeping a low profile, ensuring patients feel fully secure at all times?
So one of the things that at least a lot of the healthcare organizations that we work with thrive on is patient flow, right? Because one thing you don't want to do is disrupt the flow of the hospital, the flow of the facility, wherever the the need is. For example, like in maternity, when you're walking up to go visit somebody, there's a door, that barrier, there's an intercom there, clearly states where you need to go. You meet someone inside, you sign in. Like there's a lot of different things that they try to do to make it easy on the patient and visitor, or even the staffing. So like a lot of the card access, depending on where you're trying to go, you keep your badge on you at all times. People know that there's card readers to get through the doors you need to go to, all that stuff.
Yeah, it's definitely a balance of convenience and safety, between, making sure that these different units are secured versus, making it easy for, the actual patients that need to be there to get into those units. But you also have to make sure you're keeping the bad actors out as well. So again, it goes back to talking with the staff, talking with the security management team and saying, hey, this is what our thought process is. This is how it's going to affect the patient flow. And making sure everyone's on the same page and, there's a clear path forward in most of these areas.
Nathan?
Yeah, I wanted to just piggyback off what you're saying about the different teams and how they're interacting. From my conversations with folks in the healthcare industry, with the pace and the 24-hour nature of these facilities, there's constant changes that we talked about earlier. And when you do make a change to, security operations or security processes, just kind of practicing for what happens when things do go wrong is incredibly important. And, where we really see Oosto's technology deliver value to customers, I think is when we're able to get information in people's hands sooner about threats or concerns, or, even behaviors that are suspicious. It could be from a threat perspective, but just from a wellness perspective, if we are able to use cameras that are in the parking lot, maybe somebody falls who's coming in for just a regular wellness check, to be able to get somebody out to help them within minutes instead of, when the next person pulls in and notices them. Sometimes that can save a life. So we're really passionate just about working with teams to, really strengthen any, gaps or decrease their time to respond, so we can prevent that next incidence of violence or somebody having a worse outcome because people didn't know in time.
Thank you. As healthcare environments evolve, what emerging security trends should leaders be paying attention to?
That's a good question. And one of the things they have to look at is how busy, what the needs are. Like I know I'm going to touch back on a lot of things I talked about, but it boils down to what is needed in that area of action. Like where are the points that need to be addressed? Where does security need to be implemented? Where do the AI stuff need to become in play, and where do like weapons detection, stuff like that? There's all kinds of aspects that come into an area of any one of these healthcare facilities that you're working in.
Yeah, technology is advancing every day and really is just educating these hospital systems on how to best use them. And, what you mentioned was, cutting down on the response time and using what you already have and just growing it, right? And making sure you have the right foundation and you can use, that technology and making sure that it fits the needs of the hospital and the staff and the patients.
Yeah, I think, you have thousands of people coming in a day in a lot of these settings. And to manage all of these access points and the things that we know could go wrong, and do that with what I would consider as zero trust architecture is the challenge. So you look at, managing your access points, and you look at making sure the visitors are known, by somebody and checked in. But then you're also able to track that flow of all the different people, so you can start to look for anomalies. And then when something does go wrong, how do you act quickly and react and get security and get personnel kind of into their, practiced response, so you can kind of limit, what are the potential outcomes when something goes wrong, and try to make that as positive or limit the damage as much as possible. We've talked at length about violence in healthcare settings, and it's something that has become a norm, and it doesn't need to be the norm. And that's what we're really passionate about, is helping teams respond as quickly as possible with the right resources. So the flow of information and the speed with which teams can communicate and get into the right, response measures is really what's going to drive these places from being areas where people are focused on care, but no, hey, we have to maybe be a little bit cautious, to places where people can go and they know they're safe because the people who work there are enabled to keep them safe.
Absolutely. So to continue on this conversation, what solutions are working? What are the practices that are really securing medical facilities and the security teams are very confident in? And what brings that about?
So there's a couple things that they do. So one of the things they're doing is, pivoting where people can enter the spaces. So there's visitor entrances, there's staff entrances. A lot of times staff can come through the visitor entrances, but typically they want them to come through where the staff is supposed to designate to come through. Some of the other things they're doing on visitor side, they're putting in cameras that pick up facial rec. There's weapons detection systems going in at these entrances. Everyone's getting screened that comes into these facilities. And then one of the other things that security and operationally they're doing is they have command centers now, and they're all up to build. Like there's designations for people watching card access doors, who's scanning in, how many people are coming through here, and then watching visitors, and then also watching alarms come in, audible alarms come in for any sort of anomaly,
Yeah, they're also implementing panic button systems that will go to their security operations centers, and again, cutting down on the response time, making sure that it's actually showing exactly where that panic button was pressed. A lot of these healthcare organizations have mapping that shows if a door was forced, a panic button was pressed, a camera will pop up. Tying all their what they have into one system so they can respond accordingly.
Yeah, and to kind of bring up a couple points that really highlight what you guys already mentioned. You have to also look at things like social engineer, right? So it's not that hard to impersonate a nurse. You can buy scrubs on Amazon and show up with the right color and claim to be somebody that you're not, and look to gain access to the pharmacy to get pharmaceuticals for whatever reason, or to take equipment, or maybe you felt like a family member didn't get the right type of care and you have a bone to pick, and when you left and you were unhappy that they might flag you if you come back in through the main door. So we look at those hard to solve challenges, and we provide a solution to them and give teams a chance to be alerted in advance when that known threat is coming at you, either through the main door or the back door. And then we also look for the behaviors that really don't belong, to try to give teams the data so that they can respond quicker. So we're seeing more and more teams are looking to implement this because there's creative ways you can use it to help the team respond to the threats before something escalates.
That is great. I think we'll wrap up for today, but thank you all for your time here, and this has been a great conversation.
Awesome. Thank you.
Thank you.
Thank you, guys.